Hello and welcome to the Public Square, a show that explores public affairs and religious liberty issues that affect our nation and beyond. I'm your host, Paul Goodridge, and I'm the Public Affairs and Religious Liberty Director for the South Central Conference of Seventh day Adventists, located in Nashville, Tennessee. In each episode, we'll talk to people who are on the front lines for the fight for civil and religious liberty. My goal is to inform about issues that directly and indirectly have an impact on everyday life, ignite meaningful thought and reflection, inspire my audience to action, and integrate faith principles in how we relate to others. In today's show, we're going to talk about healthcare in the United States. The United States Department of Health and Human Services is the largest public health agency in the country. It oversees Centers for Disease Control and Prevention, which obviously seeks to control disease outbreaks. The Food and Drug Administration, uh, overseeing food safety and drug safety. The National Institutes of Health, which focuses on research. And Medicare and Medicaid, which oversees health coverage for millions of people. Today, we're going to examine changes to the healthcare system and how these changes impact access to healthcare and the healthcare experience. We're also going to suggest ways that individuals can take more control of their health and their healthcare. As usual, we invite you to subscribe, to like, and to share. And we thank you for joining us. And so let's meet in the public square. My three guests this evening approach the topic of healthcare from positions of authority. First, we have Dr. Chinwe Efribe, who is the founder and CEO of a pediatric direct primary and specialty care clinic, which seeks to redesign how youth and young adults experience healthcare. We're also joined by Dr. Shauna K. Denham Wilkes, who is the Chief Operations Officer at New York Health and Hospitals at McKinney Health System. And finally, we have Dr. Zakiba Henderson, the founder and principal consultant of Equity, Safety, and Well-Being Consultants, and a senior health advisor at the National Institute for Children's Health Quality. So, ladies, good evening and welcome to the public square.
Thank you so much.
Thank
It's great to be
you.
here.
All right. So we're in the month of March, and so it's Women's Month, and so it's good to have be surrounded by such talented and knowledgeable and expert ladies in the medical field. So let me kind of begin a little bit by just asking a general question, and each of you can answer this question. If you had to give the American healthcare system a checkup, so to speak, a report card today, what grade would you give it and why? And let's begin with Dr. Henderson.
I would give a grade of a C minus. Yeah. So there are some good things, but the bad sort of outweighs the good and drags that grade down. For a country that spends more per capita on healthcare than any other country in the world, we have a serious issue with the quality of care that we provide, the cost of care, access to care. We also have issues, with just overall lifestyle issues and life expectancy in this country that has come on the downside, is declining. And then specific to my field, I give the minus on the C specifically related to how the health for mothers and babies are in this country. And it's not great. We have some of the worst infant and maternal mortality in the world for an industrialized nation. So C minus.
Mm. Okay. All right. That's kind of fair to. I mean, it's still a passing grade, but it's getting down there. Okay,
Good.
Dr. Efribe, do you give a better assessment?
I know. I was hoping to maybe, but I actually agree with that C minus. I
Okay.
don't know if I would go any lower because I think maybe when we think about how far we've come along with research, a lot of institutions are really seeking to improve care. There are a lot of innovation, and whether it's technology with AI, being implemented in a lot of different ways to optimize care. I see the effort, but when it comes
Mhm.
down to the front lines, practical applications of well-being, yeah, I think we're not quite there yet.
Mhm.
Especially as we're trying to balance the care of the population and the care of the people who are caring for that community. Sometimes I think those who are in the healthcare setting, in the healthcare space, we're not necessarily practicing what we preach, and so it's hard for us to support our communities to be healthy if we're also struggling within our own infrastructure. And so I feel like
Mhm.
there's room to go for us to maybe put a mirror to ourselves, and if we're able to model what health looks like, that is promotion, not just sick care or treatment, I think we can maybe expect more from our community members.
Mhm.
So, but that's where I am,
Okay.
especially
Two
with
C
adolescents,
minuses.
with teens.
Dr. Denham Wilkes, please. Is there any hope?
I think what I'm hearing from my colleagues is that because there is a difference between the healthcare and the healthcare business, that we're really having to grade on a curve, right? So balancing a lot of factors, especially because we know that there remain a lot of inequities still in the care that's delivered. And so the costs themselves make the pathway to equity a really steep climb. So I think you're hearing that we are grading on a curve, but I'm willing to stay in the C minus category right there with my sisters on this because we're trying to balance so many things every day, especially in the roles that we all play.
Mm,
Mhm.
mercy, mercy. Okay. Well, let's dig into this. Let's dig into this. So, from your unique perspectives, what changes, whether it's policy or they call social, uh, do, do you feel are currently shaping healthcare access and quality to access in this current administration? And anybody can jump in.
We can talk about this all night.
Hmm.
Yeah. Uh,
That's,
we have an issue with policy in this country. Um, the policies don't seem to be developed to benefit the people as a whole. And we know with the many cuts that have been recently made and that are planned to Medicaid in particular, and issues with hospital closures and no investment in the workforce, and issues about, the business of medicine. I heard one of my colleagues mention about the business of medicine, how it is a business, and how, there's private equity in healthcare and investment, and decisions that are being made around the money and not necessarily around the outcomes and care. Um, there are a lot of issues with policy, and it doesn't take into account what communities are facing. We have a problem with the policies, for example, around vaccination. And we know that it has come to a point of legal fights over some of the recommendations that are coming out of our government and the policies around the importance of vaccination. And we have ongoing outbreaks as a result of the lack of trust and weaning trust in the recommendations and the policies that our country is developing. So I think the main areas where there have been huge shifts and changes is around policy around Medicaid policy, Medicare policy, and payment for healthcare.
mhm. Okay. Okay. And anybody else want to jump in?
I want to pull that thread a little bit because as a result of circumstances beyond the control of the healthcare provider, the healthcare caregiver. There are going to increasingly be impacts to the delivery of care that really positions America's healthcare system to be in a season of unprecedented constraint. And those constraints will impact us in areas where we really don't have any room to give. Healthcare margins are very razor thin, but so is it in terms of the business side, but so is it in terms of the advances that we have been making in various aspects of healthcare. As a clinical psychologist, when I think about the fact that we have had the greatest surge in people accessing mental health services, and to weigh that with this period of constraint, where one of the first places that we're going to see the impact to cuts to services is going to be around vital health care, including that of mental health. And that touches on so many aspects of society that we deal with, where in situations where we're helping the most marginalized. And so it's almost as if all the hard work that has been done on the ground that impacts people directly is going to face some serious headwinds. And so the constraints in the delivery of care that are going to come out of this political season are going to impact us in ways that feel like we've taken one step forward and 100 steps backwards.
Mm.
Hmm.
Yeah, I like to echo the. Oh, sorry. Do you have another question?
No, no, no. Go ahead, please.
Yeah, with regards to mental health, because I think thinking about how healthcare right now is focused on, what we see, we're missing out on the things that we can prevent, and the efforts that were really put into vaccines and trying to do a lot more prevention really is becoming challenging to say the least, because now having conversation with the patient in the room, you know, they're asking me what's true when the
Hmm.
bodies that we used to depend on to provide accurate information, evidence-based information, things that provide some solidarity, like even within our own group, if that's a bit shaky, it makes it harder for us to develop rapport with those who are in our exam rooms. And so I think it's really thinking through, how do we maintain our connection, our relationship with those that we're caring for, but at the same time provide them that surety that we're making our decisions based on evidence. And I think that's harder and harder for us to prove that if we don't have a backing from the policies that are being made through the administration.
Hmm.
But
Mm.
Yeah, and
Yeah.
I think there's just this in this season. It just feels like policymakers really don't care about us and our health. Um, I mentioned about vaccination, but even thinking about, in comparison to the previous administration, and not even talking about political party, but there was a lot of emphasis, for example, on maternal deaths and recognizing that, young, healthy women were dying unnecessarily in this country. But all of those efforts, many of them have been rolled back completely.
Mm.
And just a complete 180 from, some of the policies that were already in place, really to keep people safe in this country, they seem to be being rolled back. And resources are not being directed, toward the things that will make our country healthier. The programs, the laws, the funding, all of that. There seems to be a huge shift away from health and from public health, and the complete destruction of public health infrastructure and programs and agencies in this country is going to have an effect and impact on health in this country for generations.
Absolutely, absolutely. When you think about, the Department of Health and Human Services, and I think they estimate, was it 20,000 employees that have been lost at least, um, and so with all these reductions of personnel, key personnel, individuals with institutional knowledge, who are no longer part of agencies. and then funding that is cut, that has been which goes towards
Mhm.
research and other
Mhm.
vital programs and services,
Mhm.
etc. Opportunities. It just seems as if we're setting ourselves up for um, whether it's another pandemic or just an influx of um, ill health that can
Mhm.
or could have avoided if not for some of these
Mhm.
decisions that are being made. Am I way
Mhm.
off here?
You're right on it. Right on
Mm,
And
point.
I think that what we learned also during the pandemic is that there are other pandemics that have been happening in our healthcare system that were happening out of the sight and mind of many people, but were amplified once our world went into this most unique condition. So we
Mhm.
were already dealing with so many inequities that impacted some marginalized communities. And then once the pandemic, forced us into certain conditions, became amplified, right? People
Mhm.
who had a harder time weathering the illness itself were already dealing with compromised health that is rampant and rife in many communities. So my concern is that will it take another
Mhm.
global um, crisis of that magnitude for us to again see what's possible? Because if you think about it, this period of constraint comes after a period of permissibility. Many of the things that we
Mhm.
as healthcare leaders were told could not be done
Mhm.
during the pandemic were permitted and were able to
Mhm.
be done. And so we're seeing this, rebound and overcorrection in constraints. But we know now what's possible. And I think that it's important for us to not forget what all of a sudden became possible when
Mhm.
something came to everybody's doorstep, right? We're
mhm,
going back into a period of constraint where those who are marginalized are going to feel it first, and I really do hope it won't take something like a global pandemic that touches everybody in order for us to be able to do healthcare in a way that truly transforms lives.
mhm.
Agreed.
So how are we finding those who are falling through the cracks? Typically, as presently constructed, and kind of where it seems as if things are going, um, who are the ones who are going to be able to benefit from um, healthcare in America, and what do those who fall in the cracks? What are they? What options do they have?
Yeah, at this point, I think it's really down to some of the grassroots nonprofits who have closer access to the members who are within those gap areas,
Mhm,
whether it's providing basic needs. Because a lot of things when it comes to healthcare is not just about diseases, it's about your lifestyle
Mhm.
and, you know, food, nutrition, physical activity spaces,
Hmm.
coping mechanisms. Those are the small sort of stepping stones that, if not managed and well regulated, lead to chronic conditions. And so I
Mhm.
really, tip my hat out to those who are already on the ground, who, start different programs here and there that are meeting those needs in small pockets. Now, mind you, it's piecemeal. And that's why, we have a benefit of health efforts so that it can sort of, provide support for a larger group. But at this point, I think it's really dependent on some of the small um, uh, groups of people who are just motivated to help. But
mhm,
that's
Mhm.
where I see some people really making some moves to support our communities.
You raised a really important point in that comment about the importance of services and support outside of healthcare per se, and the importance of lifestyle. And I think as we are in this situation where people are falling through the cracks with not having you know adequate medical insurance or not having, access to providers in their area, it's going to be even more important to push some of those preventive methods and lifestyle issues to help prevent disease. Prevention is going to be oh so much more important. And then all of those other services that also help people, people who are in food deserts or people who need support with housing, because we know healthcare only accounts for about what 10 to 20% of health outcomes, and how that other 80+% is where you live, what you
Mm-hmm.
eat, where you work, the air that you breathe. All of those things, play such a huge role in this time where there seems to be a de-investment in health, in public health, and healthcare is so much more important to be, super ultra local, and those programs that happen within the community to help support people, those other factors that contribute to health is going to play such a larger role. And it's so wonderful seeing, these organizations really take up the slack and providing services to communities to help them stay healthy.
Mm-hmm.
Mm.
I want to
So, I,
call out also the caregiver. And when I mention the caregiver, I'm speaking about the clinical and non clinical staff that work in
Mhm.
healthcare settings who are facing unprecedented levels of burnout, who are still experiencing post traumatic stress in many cases from working through the pandemic. We also know that the healthcare workforce relies very heavily on people of color. And often, what we find is a great pocket of people of color who are working in healthcare, especially in systems like the ones that I work in, which is a safety net hospital. I'm actually working in the largest municipal healthcare system in the United States, New York City Health and Hospitals. In those communities, many of the caregivers come from the communities as well. So not only are they delivering the care, but they're also experiencing many of the healthcare issues that are being seen by the people that they're treating. And so they're also, coming to work, but wondering about food and about housing and about all the issues that the patients themselves face, even access to care. So caregiver support is going to be even more important in this day and age to make sure that we have a well workforce to deliver the care, and also to make sure that we can stem some of the shortages, because healthcare workers
Mhm.
are exiting healthcare in large and concerning numbers.
mm,
Mhm.
mm,
I love that you have concern for the workforce. I really appreciate that. As a care provider, and the fact that you raise the issue of the well-being of the workforce is so important. And often, providers get painted as the villain in all of this. And I think it's so important that you raise, consciousness around the well-being of providers. It's so important, especially with the shortages and the increased patient loads and increased hours of work, and firings, even when they're shut down a whole, unit of a hospital, not having a job or having to find work elsewhere. There's a lot of pressure. And yeah, thank you for appreciating the workforce. It's really important.
yeah.
We're not the villains.
Yeah. So it's I was having a conversation with a doctor who was transitioning his practice, insofar as becoming more of there's a I don't want to say a concierge, but more
Mhm,
specialized in terms of fewer individuals, fewer
mhm,
patients, but being able to spend longer, more time. And he was just sharing with me his journey. That's how he's always sought to practice,
Mm-hmm.
but being constrained in an environment in which you've got to see 30 patients just to be able to make it. And
mhm,
so he was sharing how he would do things and work longer extra hours at other opportunities just to support the practice, just to be able to give the quality of care to
Mm-hmm.
patients. And it really kind of opened my eyes in terms of the the plight and the constraints that healthcare providers go through.
Mhm.
And so, yeah,
Mhm.
I
Yeah,
understand.
especially with consolidation of all of these, health networks, hospitals, systems, buying out this system, and then providers having to change how they do things based on whoever the new system that took over the previous system that they worked for.
Yes.
It's tough.
Yeah, it is tough. Especially, a friend of mine just sent me a message about an urgent care network that was about to change their model to hire less physicians and more mid levels. And mind you, I love working with mid levels and nothing bad against them at all. But just looking at the different care models to cut down costs and
Yeah.
expense. And so the question now is like, where do they fit into the picture moving forward? But I can attest to the physician who changed locations and transition because that's what happened to me. I worked in an FQHC where I was expected to see about 30 patients a day.
Mhm.
And when I expressed to the management that I believe my quality of care is starting to be affected, is there a way we can look at my panel and see where we can sort of like adjust? And I received no response. And and I say no response as like this indirect different ways, like, oh yeah, we'll talk about it, but it was a lot of deference. And
Mhm.
I think when my patients started telling me that Dr. E, you're always apologizing for being late, and he's like, how can you how can you maintain in a system like the system doesn't allow you to be your best self? And so it caused me to sort of like separate. And yes, it's a direct primary care practice where I spend time with my patients. I have diverse payer mix, so that it allows me to spend that time and not
Mhm.
have to see so many patients. And I think a lot of clinicians are starting to think of different models of where we can be reminded of why we went to medicine in the first place, but still find creative ways to still keep the lights on.
Yeah. What I'm hearing, generally speaking, is a huge disconnect between leadership within, not just Department of Health and Safety, but just whether it's corporations, hospitals, systems, etc., leadership and the boots on the ground. And
Mhm.
Dr. Denham Wilkes, you're kind of in both worlds, so to speak, because you're now in that level of corporate leadership, but before you were kind of functioning in boots on the ground. So kind of help us navigate this um I can't think of the word.
It is a unique position, especially moving from being a clinician with direct patient contact into an administrative role. However, it does lend me some street cred because people know that I actually know
Mhm.
how to open the electronic medical record. People know that I actually know what it is to sit in a team meeting, to round, to build treatment plans, to do assessments. And
Mhm.
so when I'm sitting with leaders, I'm bringing that experience into the room and trying to set the context for why things are happening and why decision making needs to consider things that maybe aren't often considered, like the clinical or non-clinical caregiver, and centering the patient in a real way as an expert in their care. And so also when I am speaking with persons who are the continuous caregiver and actually delivering the strategy, they're the ones who are actually letting us know if the decisions are going to work or not.
Mm.
I'm listening in a way that doesn't forget where I came from. So I think
Mhm.
that that connection does help me to invite the caregivers to the decision making because the solution is often at the front line, like 80% of the time, right? You know, so if we're someplace else coming up with a solution and then going to bring it to the front line, they're going to tell you right away within just a few minutes of hearing this brand new shiny idea with this brand new acronym, some pens and a mug, whether this thing is going to actually work. And so instead of doing it that way and all the holes being pointed out in that direction, fill the gaps by making sure that the human experience of both the recipient of care and the caregiver are baked into how we build solutions. So that's the way that I work. It's probably not only because of my background as a psychologist, but I'm uniquely positioned as chief of operations because prior to this, I was the chief experience officer, right? So I'm
Mm.
always talking about the story the patient is telling, the story the staff is telling. So that is kind of baked into the way that I think. So I think you hear that a lot in the way that I lead, and that does help me when we have to make those tough decisions in an environment of so much constraint. And I also do always remain hopeful and optimistic because I know the creativity that's there, and that if we just bring it together, it will help us to find the way forward.
Hmm. That's great. That's great. Dr. Henderson, you have a unique and wide background in terms of within healthcare. How has your experiences shaped um, your philosophy and where you are now and the burning desire that you have um, within the area of healthcare?
Well, I'm an obstetrician gynecologist, but I've spent the bulk of my career as an epidemiologist and working at on population level outcomes. And it's one thing to have a patient sitting in front of you, and it's another thing to have the entire country be your patient. And
Mm,
when you look at, the big picture, the bird's eye view, and you have a bird's eye view of what's happening, it just feels so much more pressing to me, some of the work that I've done. And I feel deep grief over some of the rollbacks and some of the changes in policy that have happened, knowing that it's not just going to affect a few people, that it's going to affect whole swaths of the population,
mm,
knowing that it will, cause some people to die. And so, I'm very passionate about this work, understanding that, the decisions that are made from the top impacts everyone. At the same time, I know that there are things that we can do. Having also the opportunity to be one-on-one with patients, working with community-based organizations, and working locally, knowing that we can mitigate some of the harm through the work that we do in our own backyards. And because of that, I've made a huge shift in some of the work that I do and how I do it by working with, working locally and trying to have, still having population level impact through the collective efforts with what's
mhm,
happening in communities. And I think it's so important to acknowledge that there's so much wisdom and so many solutions right in the community. There are so many committed, people who are working really hard, trying to make a difference in the health of people, of their neighbors, of,
mm,
people in their church, people in their local communities. And specifically when we think about inequities and the disparities and the poor outcomes, particularly among, the Black community in this country, I think that's going to become more and more important that we rely on and support our local community-based organizations and efforts.
okay. I I kind of want to drill down a little bit more on that idea, and I
Mhm,
want to try to make it. Forgive me, it's my show, so I can kind of make it a little bit more personal. So
mhm,
I also serve as a for a local church within a
mhm,
community. um and I have a burden and an idea, in terms of trying to serve the community. And each of you in your own ways have talked about the grassroots, the local level,
mhm,
that type of thing, not necessarily looking for hospitals or institutions, but then whether
mhm,
it's organizations or maybe even churches. So let me
mhm,
pick your brain a little bit. What are some of the things that we could consider tackling, taking on um, as churches to help provide some level health support within our communities? Each of you kind of, give me some ideas to that we could possibly think about.
Well, I'm a maternal health provider, so most of my view fits around mom and baby health, pregnant people and their families,
Mm-hmm.
and there are lots of ways that churches can support families, whether it be from having. I know some churches um, have baby showers for the
Mm-hmm.
community,
Mm-hmm.
helping provide families with supplies and using that as an opportunity to also share information, whether it be health information about healthy habits during and after pregnancy, helping moms who may want to breastfeed, and discussions around nutrition, and supporting families materially with gifts and even money and things to help to support them. Churches can definitely do that. I've also seen churches very instrumental in screening fairs, health fairs. We know that there is an epidemic of heart disease and high blood pressure, and there are so many health providers that are members of churches that support churches that can be engaged with helping people identify issues that they need to seek health care for, and being a part of those types of efforts. Churches can be a part of being advocates, advocating for local, state, and federal policies that help support their communities. There are lots of things that churches can do. Those are just a few of the things that I've seen done and that are very effective.
Mm-hmm. Okay. Okay. Uh, Dr. Efribe,
Sure.
especially when it comes to children and youth, youth health. What can church and faith based groups do to make a
Yeah.
difference?
So my perspective is from the pediatric and adolescent medicine side, but I also used to be a youth ministries director at church.
Mm-hmm.
And I love AY because I feel like it's a prime opportunity to engage young people for wellness. Just doing the different activities I think are already set up within our institution to teach them about health, about mindset, about faith and what grounds you, how to cope with different situations, how to survive. Going on camping by itself is a survival mechanism for life. One of the things that I think we can expand on is really about the spectrum of health, where most times when we talk about nutrition in the church, it's mainly about, healthy eating, whether it's, veganism, vegetarianism. But I would love for us to explore, what happens when we don't self regulate how we eat, whether it's to the extent of knowing the risks and signs of eating disorders. So in adolescent medicine, that's some of the things that we address, but I don't necessarily hear us talk about that in the church. We do talk a lot about obesity, but not necessarily, again, the practical aspects of managing your how you eat and how you move. And of course, without shame, right? How do we do this in a way that doesn't make the young person feel like they're never doing enough? It's like, how do we engage them in their decision making, acknowledging their spaces for autonomy, and then creating spaces for them to receive confidential support, because there's always, I mean, church is small, so it's like if I talk to this person, are they going to talk to my mom or my aunt or my parents? How do we create a safe space for young people to be able to share things that are affecting them in their life, but then also point them to community resources for help, or whether it's connecting them to actual healthcare settings that are youth friendly or adolescent centered, that can allow them to sort of like go the next level if they are struggling with something. So I definitely see a lot of opportunity to bridge both worlds. And I tell my I tell my patients I'm bringing AY to clinic because we're trying within the clinic to do some of these activities to be help them understand that it's the little decisions in life that you make that can either lead you to good health or lead you to poor health. And you know there are studies that look at young adults in the healthcare system. Somewhere they fall off. Like the healthcare system is really geared towards pediatrics, like the babies, right? They come on a regular, but then somewhere about 18, it's like, they don't have to come as
Mm-hmm.
often, or they go off to college, and there's that sort of disconnect with the healthcare system, and then they show up as adults. But the
Yeah.
thing is, they're showing up as adults with diabetes or high blood pressure
Mm-hmm.
or mental health conditions, and we've missed an opportunity right in between the adolescent period between, somewhere 16, 15 up until 25, 26, for us to teach them healthy lifestyle behaviors, right? And how to know when to ask for help. Some of
Mhm.
those things don't require a pill, don't require a shot, but it's just that opportunity to sort of like talk to them and teach them skills. I feel like we have room to go where we can partner with churches, partner with organizations, to teach them what we know already in the science.
Yeah, I like that. I like that. As you were talking, I was thinking about typically how hear the approach to health from well-meaning health ministers, directors, that they talk about, have seminars on drinking alkaline water and organic spelt, grains, etc. These things that, yes, they're good, they're aspirational, but your typical um uh the typical person, whether in the congregation or in the community, don't have the resources to
Mhm.
go to Whole Foods or Trader Joe or even another specialized health place to get that reverse osmosis, water, so to speak. And I kind of approach the mindset of, if you're used to drinking 10 cans of soda a day, if I can help you replace
Mhm.
two or three, maybe four of those cans of soda with a
With
glass of
water.
water, then
It's
that's
progress.
automatically going to make a difference with your health. It doesn't have to be, well, no, you've got to go from 10, you know cans of soda to nothing. That's unrealistic. But gradually taking these steps and teaching them how they can make replacements.
Mm-hmm.
Yeah, I think that's a better approach. Am I way off course here?
No, you're right on track. I mean, it's part of the theoretical model of Prochaska, health behavior change, really looking at where the person is and moving just one step, right,
Hmm.
closer to where you want them to get to. Because if you
Yeah.
try to rush them too fast or too far, then you might lose them. And again, it might feel like overwhelming for them to be able to reach the goal that you want them to have.
Hmm.
But at the end of the day, it's having a goal that's person centered, but then also helping them work within their means, within their resources. And I say celebrating wins, because,
Mm,
that one step is still progress. And you just
absolutely.
kind of like make small progresses over time.
Hmm. Absolutely. Dr. Denham Wilkes, I want you to come from two different perspectives. Number
Okay.
one, as a clinician, I believe a mental health clinician before, what can we do as faith-based groups or churches to help in this area of mental health? But then I also want you to talk about the possibilities of partnerships between the local church and hospitals or healthcare systems.
Absolutely. I think that one of the things that I would love to see happen in a more pervasive way is that the church destigmatize its language around health and
Mhm.
destigmatize the way that the services are designed so that people with different abilities can see themselves as part of communities. Because often, when we look at who's missing from the worship experience, it's persons whose physical or mental or emotional differences make it inconvenient for other members of the church to worship
Mm,
in a traditional structure. So for me, I think that if we design our worship services for people of different abilities to find visibility, then we would do a great service for our community, right? And to be able to hold space for those who are uncomfortable and let them know that by God's grace, you will be all right. And
mhm,
it would be a good thing for all of us to stretch our concept of who should be in worship and what worship should look like in order to glorify God, which sometimes might mean, sitting with our own discomfort. And then also the language around health. How do we make sure that the way that we speak about health, the way that we speak about wellness is on all 8 dimensions of wellness and just not in one sphere, right? If the health message is such an important part of the gospel commission, it can't just be physical health, because if you don't have the other aspects of your wellness, your emotional wellness, your financial wellness, your social wellness in good stead, then are you truly healthy? Even if you have more muscles and abs than anybody else, right? It's more to health than
Mhm.
just how we physically appear. So for me, those are key things that I would love to see the church really address. And of course, ways to do that include programs like mental health first aid, including partnerships with bringing CBOs in, or partnering with local experts in the community to come to churches, and also those health fairs that do tend to draw people in. Have been effective and continue to be so, but it doesn't just have to be when the weather's warm. Everyone knows how to use Zoom now and other
Mhm.
social media platforms for virtual learning and virtual experiences. Help people find community, right? Also, a big thing that I think we need to focus on in the church that we don't really is grief and loss. There's so much grieving happening, in many, many spheres. So, as a psychologist, I'm often hearing people testify, and I know what they're saying in the spiritual realm. And yet, I'm also hearing this layer of significant grief, and so I think that there are so many ways that we can learn to listen in a destigmatized way that would help to answer the question as to where our local and global church should focus.
Mm, I just want to circle back on something you mentioned. CBO. For us lay people, I'm not sure what that meant.
Community-based organizations.
Oh, thank you, thank you. I'm, I'm just a lowly preacher. I'm sorry.
No, no,
And
no.
it's okay. And healthcare people love the alphabet. We have an acronym for everything. So if there's any time we get into alphabet soup, definitely call us
Mhm.
on it. We'll explain.
Okay.
And I think, and I think I did a faux pas too. I think I said FQHC, that's Federally Qualified Health Center. If I missed that earlier on.
Okay. Okay, thank you. So as we start to land the plane, because I think we recognize that, with a report card of C minus, there is great room for improvement within the healthcare system in the United States. We recognize that there have been significant changes. Um, Many of these changes in the name of efficiency, effectiveness, from a bureaucratic standpoint, and while there may be a need for it or maybe a place for it, the unintended consequences of the actual individuals who are being served or being underserved are real and growing. Um, and so there are things that local organizations, CBOs, there you go, can do to help to bridge the gap. But I'm gonna kind of stretch you a little bit, and I'm going to. I want you to imagine that you have just been appointed the director of the Department of Health and Human Services, and your first day is tomorrow. um, what is the first thing that you're going to look to do, or that you would look to do, to try to stem the tide of where we seem to be going, and where we need to go? And I'm going to start with Dr. Efribe.
Ooh, that's a tall order there.
Yeah,
Mhm.
yeah.
Got a lot of stuff
um,
to fix.
a lot of things to fix. And this may be my bias, but as I think about communities and just populations, I think about the young people and what it is we are doing to either model what health should look like, how we are, I guess, valuing what health should look like, because I think they say you put your money where your values are, or you invest in things that you value. And I think, you know, I would like us to sort of like think about how we're setting up the next generation, to improve the health of our communities. And so for me, it'll be looking at what are we doing in our schools, what are we doing in our youth serving organizations, what are we doing in our childcare settings, how are we supporting families, because I think somewhere, because even with early childhood intervention, like that was a public health endeavor that helped a lot of families, um, you know, with developmental milestones, right? Like if we can't support our families on the basics of those things, then it's harder for us to do all the more complex things. So for me, my focus would really be on how do we support the base, the foundation of of who we are hoping our community and our population will be. Because I think once we invest here, then we'll be able to see it propagate over years.
Okay. Okay. Um, Dr. Henderson,
Oh, that's a tough
I
question.
now
There's so
appoint you director of of the human services. What's the first thing you're gonna do?
First, I would clean house with the staff and get people who
Oh
are actually
Lord.
qualified. Yes,
Okay.
we would get qualified people leading all of the health agencies,
Hmm.
including CDC, HRSA, CMS, all of the organizations, FDA. Make sure they're led by people who are actually qualified.
Hmm.
And the other thing I think will be important is making sure the systems are in place in terms of surveillance and all of the things to help protect our nation if we were to be faced with another public health crisis, to make sure to restore those safety nets. And the other thing is restore funding for the research and programs that were all dismantled. So there's a lot of work, but first would be getting staff in place that know what they're doing.
Hmm. Okay. 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 Very practical. Very practical. Dr. Denham Wilkes.
I would agree with my colleagues, and then I would also be putting a plan before our legislators regarding universal health care. We already have a model for that in this country, which is Medicare, and it already exists in a way that, for those for who meet the requirements, that there is a platform and a process to have access to the care that is needed. And
Hmm.
why not extend that to every person in this country? Why not extend that in a way that allows us to take off the table access to good care based on your ability to pay? So for me, that is a vital direction that this country needs to confront, because healthcare injustice is real, and it's not going to be solved in the way that we have been addressing it at this point. It's too easy for the healthcare system to turn a blind eye. But if we were on a common playing field, then we could see some real change and real effort towards solving some of the solvable healthcare issues that we face in this nation every single day.
Hmm.
Okay. Thank you. Well, I
Yeah.
will do my best to try to get at least one of you appointed to that position.
No, thank you.
I know,
But I do want to thank each and every one of you for coming and sharing. You've given a lot of food for thought, some practical things that we can do as individuals, as churches, as faith based organizations, as community based organizations, to be able to help to improve the scorecard of healthcare in the United States because, as they say, health is wealth. And, just experiencing, um, as I'm old, getting older, and health challenges that just come with getting older, etc. um you realize that more and more people are experiencing more and more um health challenges as a result of the lack of health care that we're experiencing. And so I want to thank you for joining us. I want to thank you for taking out the time. And I'll be right back with a closing thought. As we look at the state of healthcare in the United States, it's important that we make it a priority for each and every one of us, not just for our personal health, but for the communities that we serve, for our families, for our neighbors, especially within a faith-based concept for context, excuse me, for our members, for our community. And so I just want to challenge you and inspire you to do something to whether it's to um, teach something, or at least inform about some healthcare opportunities, or just even legislate, or at least advocate for legislation that can help. But anything that we can do to encourage health. And I think the biggest way that we can encourage people is by exhibiting a healthy lifestyle ourselves. When people see that we are taking our health seriously and making those small strides towards better health, and we and foster a community that does that, then I think we can make a difference in the lives of not only our communities, not only our churches, but also this country. I want to thank you for joining us. Again, I encourage you to like and subscribe. I also want to encourage you to share this program with somebody who needs to hear this, or somebody who may be interested. We uh, are once a month on Thursday evenings. And so we look forward to seeing you in our next show. And we want to thank you again for joining us. And I'll see you next time on the Public Square.